Converting from traditional hand scrubbing to waterless alcohol-based hand rubbing has the potential of saving 2.7 million liters of water annually, according to a study published in the American Surgeon. So before you go into the operating room, should you scrub your hands in the old traditional way that is considered part of the ritual of surgery? And teaching hand scrubbing is like the baptism of medical students starting their surgical rotation. However, the question is, do we actually need to scrub our hands? Or rubbing your hands with solution like Avagard should be more than enough? If you're new here, my name is Malki Assad. I'm a plastic surgery resident in the US, and in this video I'm gonna delve deep into the scientific evidence behind the traditional surgical scrubbing versus waterless alcohol-based hand rubbing. For those who are not familiar with these two techniques, the traditional hand scrubbing is where you stand in front of the OR sink and you start scrubbing your hands and forearm with a hand brush that is impregnated with an antiseptic solution. And this process usually lasts between 3 to 6 minutes. Hand rubbing, on the other hand, is rubbing your hands and forearm with an antiseptic solution. I will take you through the recommendations of the World Health Organization, a Cochrane systematic review, multiple original articles, the recommendation from Avagard itself, and I'll finally end with some economical studies comparing these two techniques. And let's start with the recommendations from the WHO, or the World Health Organization. In 2009, the WHO published guidelines on hand hygiene and healthcare, and the publication was called First Global Patient Safety Challenge: Clean Care is Safer Care. And I'm gonna read exactly what the wording in these recommendations so people don't say I'm changing the meaning of it. On page 56 of this document, the document says it's not necessary to wash hands before hand rub unless hands are visibly soiled or dirty, which means you can still use the waterless hand rubbing without a full traditional scrubbing even for your first case of the day. Unless your hands are dirty or soiled, and in that case they recommend non-medicated soap. The document says, while this hand wash may eliminate any risk of contamination with bacterial spores, experimental and epidemiological data failed to demonstrate an additional effect of washing hands before applying hand rub in the overall reduction of the resident skin flora, which clearly emphasized that you don't need to do a full traditional scrub before your first case. And if your hands are dirty or soiled, you can just wash them with non-medicated soap and then you can apply the hand rub. One thing to keep in mind is that your hands must be dry before applying the Avagard or the hand rubs, because if your hands are not dry, that might affect the efficacy of the hand rub formulation. And that's what the document says. The activity of the hand rub formulation may even be impaired if hands are not completely dried before applying the hand rub or by the washing phase itself. Now, the document also discusses the differences between the traditional surgical scrubbing with medicated soap versus the alcohol-based waterless solutions. And the document says both methods are suitable for the prevention of surgical site infections. However, although medicated soaps have been and are still used by many surgical teams worldwide for pre-surgical hand preparation, it is important to note that the antibacterial efficacy of products containing high concentrations of alcohol by far surpasses that of any medicated soap presently available. And then the document continues, for this reason, preference should be given to alcohol-based products. So the WHO recommends using the alcohol-based waterless solutions as compared to the regular traditional surgical scrubbing. And then they talk about other important factors, and they say, furthermore, several factors including rapid action, time saving, less side effects, and no risk of recontamination by rinsing hands with water clearly favor the use of pre-surgical hand rubbing. So the benefit of hand rubbing doesn't only stop at decreasing the number of surgical site infections or the number of colony forming units on your hand, but also goes beyond that. It takes much less time using hand rubbing versus the traditional surgical scrubbing. Also, the side effects from hand rubbing are less than that of surgical scrubbing. So that's why, according to WHO, hand rubbing wins over traditional surgical scrubbing. Now let's go over a Cochrane systematic review that was done in 2016. And for those who are not familiar with Cochrane, Cochrane is a very reputable organization that performs high-level systematic reviews, which, if done well, stands at the top of the pyramid of scientific evidence. So what did this Cochrane systematic review find? The conclusion says, there is no firm evidence that one type of hand antisepsis is better than another in reducing surgical site infections. Alcohol rubs with additional antiseptic ingredients may reduce colony-forming units compared with aqueous scrubs. So the Cochrane systematic review says that there is no difference between all these different methods in regard to reducing surgical site infection. However, the hand rubbing was found to be superior to hand scrubbing in terms of reducing colony-forming units. And one thing I always found interesting and was pointed out by one of my surgeons is that after we clean our hands in the traditional surgical scrubbing way, when we're scrubbing our hands for 2 or 3 or sometimes 5 minutes, we end up cleaning these with regular water. The water that we are using is not sterile. So technically our hands after the traditional surgical scrubbing are not sterile. Just something to keep in mind. Now let's go over the application instructions from Avagard itself, which is one of the most popular hand rubbing solutions available. The application's instructions say Avagard is an FDA approved surgical hand antiseptic. Avagard can be used for the first scrub of the day and every scrub of the day. It says it needs to be applied to clean dry hands, and for the first application of the day you have to clean under your nails, but no pre-scrub required. So even the company manual, the company that makes that solution, is saying you don't need to perform a traditional surgical scrub before using Avagard for your first case of the day. Now let's go over some primary evidence, some original studies comparing the use of hand rubbing versus the traditional scrubbing. And the first study is published in Urology in 2010 from the Cleveland Clinic and is titled Avagard Hand Antisepsis versus Traditional Scrub in 3,600 Pediatric Urologic Procedures. The authors compared the use of Avagard as a preoperative hand antiseptic solution as compared to the traditional antiseptic hand brush scrubbing. And there were 1,800 patients in each group. And the authors clearly said Avagard was applied per the manufacturer's 3-step process without using traditional scrub on the first case of the day. They found 2 infections in the Avagard group and 3 infections in the traditional scrubbing group with no significant differences between the 2 groups. However, the authors noted the time difference between the 2 techniques. One took 2 minutes, the other took 6 minutes per application, and also the difference in cost. Avagard cost was 59 cents per application, while the traditional scrubbing was $1.04 per application. Another study I want to go over is comparative antimicrobial efficacy of alcohol-based hand rub and conventional surgical scrub in a medical center, published in the Journal of Microbiology, Immunology and Infection. The authors here also compared hand rubbing versus hand scrubbing. Then they took hand sampling for cultures before and after the surgery, and they found that the culture positive rate in the hand rubbing group was lower than that of the hand scrubbing group. Now let's talk about some studies that compare the difference in cost between these 2 techniques. The first study is from the Carolinas Medical Center in North Carolina, and the study is published in the American Surgeon. And the authors say converting from soap to alcohol-based waterless scrub demonstrated a potential saving of 2.7 million liters of water annually. Can you imagine 2.7 million liters annually just from switching from hand scrubbing to hand rubbing? Another study published in JAMA Ophthalmology found similar findings. The study is from the University of Miami and is titled Association Between Eliminating Water from Surgical Hand Antisepsis at a Large Ophthalmic Surgical Hospital and Cost. The paper says, in this economic evaluation conducted at a surgical eye hospital, water savings amounted to 61,631 liters per operating room per year after sole use of alcohol-based hand scrub was initiated. The savings from adopting waterless scrub technique could be between $280,000 and $348,000 per operating room per year. That's a lot of money, especially when the cheaper technique is similar if not superior to the more expensive technique. So it seems that the scientific evidence and the recommendations from big organizations like the WHO would recommend using the hand rubbing as a superior technique compared to the hand scrubbing. Because even if the efficacy of hand rubbing is similar to that of traditional hand scrubbing, the other advantages such as saving time, less side effects, saving so much money and so much water that is not available in so many developing countries would favor the hand rubbing over the traditional hand scrubbing. However, it also seems that there is no scientific evidence supporting the use of traditional full surgical scrubbing before your first case of the day. However, if your hands are dirty or soiled, you have to clean them with water and soap, but you can use non-antiseptic soaps. And then you'd apply the hand rub solution over dry hands. So why do you think we continue to do the traditional surgical scrubbing? Is it just because it's part of the surgical ritual? Or are there other reasons? Also, what is the method that you use in your country or your hospital? I would love to hear your thoughts by dropping them in the comment below. Also, a disclaimer, this video is for informational purposes only and is intended to summarize the existing literature about these two techniques and should not be considered as a medical advice. If you want to decide which technique you would like to use or the other, I would recommend you yourself going through the evidence I went through, which I will leave all the links for that in the description below. If you find any value in this video, I would really appreciate it if you give us a thumbs up, subscribe to the channel, and share this video with your colleague who might be interested in learning about this topic. Now, if you'd like to learn how to find research positions in the US, make sure to click on the link here. Thank you everyone so much for watching. Peace.